as we kind of conclude our session today, I did want to ask you, what kind of like words of either advice or encouragement would you give to a patient who was kind of just, diagnosed with heart disease or whatnot? What kind of encouragement would you give to someone?
Yeah, absolutely. Yeah, so anyone, not only with heart disease, any individual in their middle age, like 40s, 50s, or even younger, know your numbers, your cholesterol numbers, your blood pressure. That we didn't talk about blood pressure. So blood pressure is very important. If your blood pressure runs elevated, the recommendation is to have everyone the blood pressure, the top number 130 or less, and the bottom number 80 or less. Ideal in textbook, ideal is 120 over 80, but most people, we can always get some fluctuation in that. That's not the blood pressure is not like if something fixed in stone. It kind of fluctuates, but on average, we want the blood pressure to be 130 over 80 or less over their lifetime. Over their long term. Then the cholesterol. Talk to your doctor depending on your risk factors. If you're someone who already had a heart disease, then we want the numbers to be much lower. There is something called LDL, or the bad cholesterol. We want that below 70 or sometimes even below 50 in certain individuals with previous heart disease. Or if you didn't have no heart problems to your knowledge or no family history, sometimes we would be a little bit more flexible or relaxed on that criteria. It can be 100 to 130 sometimes. But knowing your numbers, then the exercising, like we discussed, there's a condition called sleep apnea. If you have history of snoring, or when you wake up, you always feel drowsy or sleepy, not energetic, you may have this condition called sleep apnea. Treating that would be really helpful to decrease the risk of heart disease. So there are a lot of things to watch for, and a lot of things that as an individual we can do ourselves to keep our heart, and by extension every other organ, because you have only one heart. If that stops or malfunctions, you are in a pretty bad situation. Then you'll be seeing more of people like me. So it's better we stay away from each other as long as we can.
Yes. Yeah. Yes. So it's great. Take care of ourselves, eat healthy, exercise, get movement. It's really important. I think that concludes the session for today. Thank you so much, Doctor, for being here and all the information. I do, again, encourage the audience to visit us at myAmericanDoctor.com or give us a call at 919-914-941-1494 to book a second opinion consultation with one of our specialists. Thank you so much for watching today, and have a wonderful day.
All right, thanks everyone. Thanks, Ariana. All right, we'll see you next time. Thank you.